For more information, visit lcdcexamreview.com. Hello everyone, and thank you for joining me in this presentation. I will be talking about practice domain number 6, Client, Family, and Community Education. This is part of a series of video lessons for the 8 practice domains for substance abuse counselors. Addiction counselors play an important role in providing clients, family, and significant others, and also community groups with information about risks involved with alcohol, tobacco, and other drugs use. We also play an important role in providing available prevention, treatment, and recovery resources. Addiction counselors must be able to provide education, both formal and informal, about substance abuse prevention and treatment programs and the recovery process. In order to help people from multicultural backgrounds, we need to keep in mind cultural differences among diverse communities, cultural differences in substance use behaviors, delivery of educational programs that are culturally relevant, research and theory on prevention and substance abuse problems, learning styles and teaching methods that we can adapt to our clients, how to facilitate discussions in a safe and respectful environment, how to prepare, outline, and hand out materials, how to make public presentations to deliver the information effectively, cultural issues in planning prevention and treatment programs, age and gender differences in substance use patterns, culture, gender, and age-appropriate prevention, treatment, and recovery resources, and awareness of our own cultural biases. Also, we must be able to describe the risk and protective factors that increase and decrease the likelihood for an individual, community, or group to develop a substance use disorder. Our knowledge in this area includes the risk and protective factors for the onset of substance use disorders and how to present the issues from a non-judgmental perspective. We also want to be able to describe the warning signs, symptoms, and the course of substance use disorders. We must be familiar with the continuum of use and abuse, including the warning signs and symptoms of a developing substance use disorder, and the current Diagnostic and Statistical Manual of Mental Disorders, DSM, categories or other diagnostic standards associated with psychoactive substance use. We want to be able to describe how substance use disorders affect families and significant others. We need to educate our client about how psychoactive substance use by one family member affects other family members or significant others, the family's influence on the developmental and continuation of a substance use disorder, and the role of the family or significant others in treatment and recovery. If you go back to my presentation on counseling for groups and families, you can see a little bit of more detail on what is required to in regards to skills to conduct family counseling. We must be able to describe the continuum of care and resources available to the family and significant others. Our goals are to present available treatment options, including local health, allied health, and behavioral health resources. Motivate both family members and the client to seek out resources and services from the full continuum of care. Describe different treatment modalities. Identify and make referrals to local health, allied health, and behavioral health resources. Keep in mind the difficulties families and significant others go through when seeking help. We must work from a strengths-based principle, which emphasizes client autonomy. We must be able to describe principles and philosophy of prevention, treatment, and recovery. So we must be familiar with the models for substance abuse prevention and treatment and recovery from substance use disorders. Understand and describe the health and behavior problems related to substance use, including transmission and prevention of HIV, AIDS, tuberculosis, sexually transmitted diseases, hepatitis C, and other infectious diseases. And we need to be aware of our own biases when presenting the information. And finally, we must be able to teach life skills, including but not limited to stress management, relaxation, communication, assertiveness, and refusal skills. So we must be able to deliver educational sessions. The recommended readings for this topic are mainly this Matrix IOP, which is the Counselor's Family Education Manual. You can download this publication from the SAMHSA website for free. They have a PDF version of the manual plus PowerPoint slide presentations. Thank you very much for watching this lesson. Don't forget to subscribe to my channel and follow me on Facebook, Google+, and my website lcdcexamreview.com for more information about resources and links mentioned in this video. Please visit the description box and you can find more information there about other things that I have mentioned in preview videos. And don't forget to leave a comment, a suggestion, feedback, and I will see you guys in the next lesson. Thank you. Bye-bye.